Hello, my name is Jon Howard, and welcome to our video Simulation as a Safe Space. We're going to talk about simulation, how to make safe for the people who are in your simulations. We're going to talk about a couple things today. One, to identify methods to create a safe space for simulation and the participants in that simulation, and to identify potential concerns of participants who are in your simulation. So being in a simulation puts participants on a stage, essentially. They are doing something in front of other people, and those people might be in some way judging them, seeing how they're doing it, whether or not they agree with it or not. This can cause anxiety. Frequently what we've seen is that it causes a lot of anxiety in the providers who've been doing this for many years. There's a bit of self-image of I'm good at what I've been doing for X number of years, and it can be a little anxiety producing if a simulation shows that perhaps they aren't as good as what they think. So set some expectations at the start of the simulation. Introduce yourself, why you're here. This is an educational thing. This is not for a grade. This is not for filing something in your performance records about how good you are. It's an educational experience so you can get something from it that you can use on your real patients. Introduce your equipment, introduce the mannequin, show what it can do and what they can do during the simulation so they know the rules, and explain the goals of the exercise. Why are we here? What do we want you to get from this? Create a shared mindset at the start. One of the lines we actually it's a question. One of the questions we use at the start is anyone here to hurt the mannequin? People tend to smile a little bit, but no one raises their hands. We're all here to do the right thing for this patient who happens to be a mannequin. We're all here to become better providers. That's what the point of this is, nothing else. Take the spotlight off of them as well in some cases. Look at what other people are doing. Do you like what you're seeing? Steal it from them. Use it in your own practice. If there's something you don't like, don't use that. Think about how you can remove that from your practice. What happens in Vegas stays in Vegas. It's the line we actually use during the simulation briefings. What happens during the simulation and the debriefing stays in the room because that's what's fair. Nobody else was here. They don't get to comment on what happened. Also, partly because we reuse scenarios, and if you tell everybody else what the scenario is, they won't get the same amount out of it. The real point of this, though, is not whether or not you did well in the simulation. It's what does this simulation get you that you can use on your real patients. Right? If you do some version of just horribly, that's okay with a mannequin, as long as it helps you be better with the real patients down the road. Right? So in summary, simulation can be anxiety provoking. We know that can happen sometimes. We're going to take proactive steps to create an environment that makes people feel safe while they're doing the simulation and helps them use the simulation to learn how to be better providers.